Daratumumab in primary effusion lymphoma. To the editor. Primary effusion lymphoma is a rare type of non-Hodgkin's lymphoma that is associated with human immunodeficiency virus, HIV, and human herpesvirus 8, HHV8, infections. One It typically manifests with lymphomatous pleural and peritoneal effusions. Neoplastic cells have an immunoblastic to plasmablastic appearance, and the diagnosis requires the presence of HHV8 infection. Most primary effusion lymphomas have lymphocyte activation markers, CD30 and CD38, without normal B-cell markers, CD19 and CD20. The most appropriate treatment regimens for primary effusion lymphoma have not been established, but patients generally receive combination chemotherapy. Although complete response rates range from 43 to 57%, the prognosis remains poor, with an estimated median survival of approximately 6 months. One Daratumumab, a CD38-directed human Ig-1 kappa monoclonal antibody, is approved for the treatment of multiple myeloma. Two We report the successful use of Daratumumab to treat primary effusion lymphoma. A 47-year-old HIV-infected man had received a diagnosis of solitary variant primary effusion lymphoma nearly 3 years previously. He had received dose-adjusted rituximab, etoposide, prednisone, vincristine, and doxorubicin, brentuximab vedotin, CD30 targeted therapy, and gemcitabine with oxaliplatin, followed by ifosfamide, cyclophosphamide, and etoposide. Figure 1. Histologic and flow cytometric findings in the patient. Given the patient's multiple relapses, he underwent a mismatched, unrelated, reduced-intensity allogeneic transplantation while the disease was in remission after salvage chemotherapy. Although chimerism studies showed that the patient had 100% donor cells in the CD3 and CD33 compartments on peripheral blood testing and the HIV viral load was undetectable, positron emission tomography computed tomography, PET-CT, at the day 100 evaluation revealed evidence of relapsed primary effusion lymphoma. See Figure S1 in the supplementary appendix, available with the full text of this letter at nejm.org, along with recurrent HHV8 viremia. A bone marrow biopsy confirmed primary effusion lymphoma, Figure 1A and 1B, with CD38 positivity on flow cytometry, Figure 1C. At this relapse, immunosuppression was tapered, and the patient received off-label, single-agent, weekly Daratumumab at a dose of 16 mg per kilogram of body weight, according to standard administration guidelines. Although HHV8 titers may not be indicative of a response to chemotherapy, his serum titers decreased from 807,000 copies per milliliter to an undetectable level after the first dose, Figure S2 in the supplementary appendix. Repeat PET-CT after 4 doses showed a clinically significant partial response, Figure S1 in the supplementary appendix. The 5th dose was delayed because the patient was hospitalized for infection, and the HHV8 titers increased during the 2-week delay, Figure S2 in the supplementary appendix. When Daratumumab was administered again, the titers became undetectable, and CT imaging at approximately 3 months from the start of therapy showed no evidence of lymphoma. Since most patients with primary effusion lymphoma have CD38 expression, Daratumumab has the potential to be an effective treatment for patients with this uncommon and aggressive disease. Our patient had a clinical response coincident with treatment. This response was confirmed both by imaging and by a reduction in the viral load. Given the rarity of primary effusion lymphoma, large clinical trials evaluating treatment regimens for this condition are unlikely. Case series may be a more practical way to evaluate treatment response. Niravan Shah, MD. N.K. Singhavi, MD. Alexandra Harrington, MD. Medical College of Wisconsin, Milwaukee, Wisconsin. Nisha at mcw.edu. Disclosure forms provided by the authors are available with the full text of this letter at nejm.org.